Hello, my name's George Bainbridge, currently in SD6 and anaesthetics at the Bristol Heart Institute, and this is work done with my consultant colleagues, Dr. Jonathan Barnes in cardiac anaesthesia and Mr. Eltayeb Mohamed Ahmed in cardiac surgery. Our project looked at auditing peri-operative fasting in elective cardiac surgery patients with a septal send approach. Internationally, it has been accepted for years that cardiac surgery patients should be fasted pre-surgery for 6 hours. More recent expert consensus statements from 2019 Cardiac Society guidelines suggest that low-risk cardiac patients can be given clear fluids until 2 hours preoperatively. However, most major surgical specialties have extended this with a septal send policy whereby less than 150 mils of clear fluids can be sipped an hour until the time of sending. There is also limited evidence that the administration of oral carbohydrate drinks can also be beneficial in the immediate post-operative period. We aim to introduce a septal send policy for all low-risk elective cardiac surgery patients in conjunction with preoperative oral carbohydrate loading. Here at our institute, elective cardiac surgery patients are currently fasted from midnight at the day of surgery, with afternoon patients fasted from 6 in the morning. We wanted to know the reality of what was actually happening on the ground, so we performed a 2-week snapshot audit of every elective cardiac surgery patient, capturing the time of their last drink, the volume of that drink, and their planned surgery time. The results were striking, with the average complete fasting time across all patients, 23 were included, of 4 hours and 41 minutes, with more than double the current ERAS target. Morning patients fasted for an average of 4 hours and 9 minutes, with afternoon patients 5 hours and 45 minutes. The average volume of that last drink was just 37 millilitres. So not only were our patients fasting for far longer than guidelines recommend, but they were also taking minimal fluid when they were allowed to drink. In summary, this falls short of ERAS targets, and more recent evidence suggests possible benefits of oral carbohydrate loading. In light of this, we would like to implement a septal send standard operating procedure for all low-risk elective cardiac patients using specific Nutricia pre-op drinks, and we will re-audit this, aiming for higher oral intake and shorter fasting times. Thank you for listening.